Glucosamine is a supplement what has been supplied on a very large scale for humans, horses and dogs with arthritis. It's a billions of dollars and euros industry, but does it work? What are the results of scientific research? Although this channel is about horses, we will also include research on humans and dogs because the outcome is similar. It tells everything about the effectiveness in horses. Glucosamine, widely acclaimed for its potential to improve joint health, has been the subject of numerous discussions and debates. Advocates sing praises of its purported ability to ease symptoms of osteoarthritis and other joint conditions, not only in humans, but also in horses and dogs. Yet with a barrage of anecdotal claims, marketing pitches and conflicting research findings, it's easy to get lost in the noise. The burning question that remains, is glucosamine truly effective for joint health across species? Is it the panacea we've been hoping for, or just another well-marketed placebo? The answer lies not in testimonials, but in hard scientific evidence. To find the truth, we must delve into the research. Let's start with humans. When it comes to humans, the effectiveness of glucosamine is a hotly debated topic. This small molecule, often hailed as a miracle cure for joint health, has been under the scientific microscope for years. The body of evidence on glucosamine's efficacy in humans is a mixed bag. Some studies hint at potential benefits, suggesting modest improvements in pain and function for individuals grappling with osteoarthritis. Yet others present conflicting results, casting a shadow of doubt over these positive outcomes. The landmark glucosamine chondroitin arthritis intervention trial, or GATE for short, epitomizes this conundrum. This trial showed mixed outcomes, with the combination of glucosamine and chondroitin sulfate demonstrating limited efficacy when pitted against a placebo in certain patient subsets. Adding to this complexity are methodological roadblocks. Variations in study design, inconsistencies in dosages and formulations across research studies, and even the types of glucosamine used, all contribute to the uncertainty surrounding glucosamine's effectiveness. The critics have their own bone to pick with glucosamine. They argue that the perceived benefits of glucosamine supplementation in human trials could be influenced by the placebo effect and industry bias. In simpler terms, if people believe they're receiving a treatment that will help, they might feel better, even if the treatment is ineffective. Similarly, studies sponsored by the industry may unintentionally skew towards positive results. These controversies make it challenging to draw definitive conclusions about glucosamine's role in human joint health. While it's clear that some individuals may experience improvements in their symptoms, it's equally clear that these benefits are not universal and may not be solely attributable to glucosamine. In the end, the jury is still out on glucosamine. It's a classic case of more research is needed before we can fully understand and harness its potential benefits for joint health. So the evidence for glucosamine in humans is mixed at best. What about horses, though? In the equine world, glucosamine is often touted as a joint health wonder supplement. It's common to find it in the feed room of any stable, especially those housing performance horses or those battling osteoarthritis. Its popularity rides on the wave of countless testimonials and anecdotal reports that sing praises of its ability to support joint function and enhance mobility. But let's rein in the enthusiasm for a moment and ask, what does the science say? Unfortunately, just like the human studies, the scientific landscape for glucosamine use in horses is rather barren and inconclusive. While there are some studies that suggest potential benefits of oral glucosamine supplementation in improving lameness and joint effusion in horses with osteoarthritis, they are few and far between. Moreover, the results are often conflicting. Some studies suggest a positive effect, while others fail to demonstrate a significant difference compared to placebo treatments. These conflicting results stir up a cloud of doubt and uncertainty, making it challenging to reach a solid consensus on the effectiveness of glucosamine in equine joint health. A major hurdle in this scientific journey is the lack of rigorous, large-scale clinical trials. Most studies conducted so far have been small in scale, with varying methodologies and inconsistent dosages. This lack of standardization makes it difficult to compare results across studies and draw reliable conclusions. Critics also point to the influence of the placebo effect and industry bias in these studies. Much like in human trials, the perceived benefits of glucosamine supplementation in horses might be influenced by these factors, further muddying the waters. In the end, the scientific verdict on glucosamine for horses remains for now undecided. It's a complex puzzle with many missing pieces, and until more rigorous, well-conducted research is carried out, we can only speculate about its true effectiveness. Just like in humans, the evidence for glucosamine in horses is inconclusive. But what about dogs? Many dog owners swear by glucosamine supplements for their furry friends' joint health. They perceive improvements in mobility and comfort, especially in dogs suffering from conditions like osteoarthritis or hip dysplasia. But what does the scientific community have to say about this? Research on glucosamine's efficacy in dogs presents a mixed bag, similar to its human and equine counterparts. Some studies hint at potential benefits. For instance, there are instances where dogs showed signs of increased comfort and mobility following a regimen of glucosamine supplements. However, it's important to note that these findings are far from universal. A systematic review published in the Journal of the American Veterinary Medical Association, or JAVMA, sheds some light on this topic. This review analyzed various studies on the use of oral glucosamine and chondroitin sulfate supplements in dogs with osteoarthritis. The conclusion: the evidence is mixed. While some studies suggested potential benefits, others failed to demonstrate a significant difference compared to a placebo. This inconsistency in research findings fuels skepticism about glucosamine's effectiveness in dogs. The studies that did report benefits were often met with criticism for their methodological limitations. For instance, some studies had small sample sizes that could skew results, while others failed to use a placebo control, which is crucial in determining the actual effectiveness of a treatment. Additionally, the lack of standardization in glucosamine formulations and dosages used in these studies further complicates the matter. This makes it challenging to draw definitive conclusions about glucosamine's efficacy in dogs. Furthermore, individual variations in how dogs absorb and metabolize glucosamine could also influence the observed effects, adding another layer of complexity to the debate. Again, the scientific evidence for glucosamine in dogs is far from convincing. Much like in humans and horses, the research presents a puzzle with missing pieces. So where does this leave us? Well, as the saying goes, the jury is still out on glucosamine. Until more rigorous, well-designed clinical trials are conducted, the effectiveness of glucosamine for canine joint health remains an open question. We've delved into the research on glucosamine in humans, horses, and dogs, and we've found that the evidence is, well, complicated. Moving on to horses, we encounter a similar situation. While glucosamine supplements are commonly used in the equine world, especially for performance horses or those with osteoarthritis, the scientific evidence is sparse. Some studies hint at potential benefits like improving lameness and joint effusion. But once again, the lack of rigorous, large-scale clinical trials clouds the picture. In all three cases, humans, horses, and dogs, the skepticism surrounding glucosamine's effectiveness is apparent. There's a clear call for more rigorous, well-designed clinical trials with standardized methodologies to shed light on this issue. Only then can we begin to separate fact from fiction and truly understand the potential of glucosamine as a joint health supplement. But remember, science is a process, not an endpoint. It's about asking questions, gathering data, and refining our understanding over time. So while the jury is still out on glucosamine, it's important to stay informed and keep an open mind. And let's not forget the importance of consulting with a healthcare professional. Whether it's for you, your horse, or your dog, starting a new supplement regimen should always be done under professional guidance. They can provide personalized advice based on your specific needs, medical history, and the latest scientific evidence. Another argument against using glucosamine in acute arthritis is that glucosamine is mainly supposed to prevent damage on cartilage in joints. Damaged cartilage cannot be restored. There are other supplements with more concrete scientific results like MSM, devil's claw, rose hips, and so on. Glucosamine is good for billions of revenue for the pharma industry without real scientific efficiency. If you found this video helpful or interesting, show some appreciation by hitting the like button and subscribing for more. This helps us a lot so we can make more informative videos about horses.